Today, I want to welcome back Matt Ohrt. He's a returning guest on the Leaders and Legacies podcast. Last time we had Matt on, he was one of the founders of Self Fund Health up in Wisconsin, and now he's doing something new. And, for those that are maybe hearing one of our first medical episodes, it's a particular passion for me to amplify the voices of the people that are fixing healthcare. And, for me, 3.5 years ago, I racked up $2 million in medical expenses and by some strange reason lived. And there was a lot of things that was done wrong. And so I think there's broad agreement that things aren't working the way we'd like them to work in healthcare. And Matt is one of the people that's fixing them. So he started Self Fund Health and now he's starting Rise Up Health. Matt is the author of a couple books, Save Your Company, Don't Feed the Beast. He's also hosted a conference, the Don't Feed the Beast Conference. And he's recently released another book, Welcome to Home, Fostering a Family. Matt is a foster parent. Matt, welcome.
Yeah, good morning, Craig. Great to be with you again. I look forward to our discussion.
So tell me a little bit about this book, your new book, Welcome Home.
Yeah, I'll tell you, children's books are much easier to write than regular books, but in a different, challenging in a different way. But I mean, that book was start to finish in something like 3 months, which is far different. It's probably more of a challenge of the illustrations than the wording. Of course, the wording is much more brief, but yeah, I just kind of I take the foster kids, and we have one adopted now. The second batch, I call them. I take them to McDonald's Playland to kind of let get their stress out. And it's an indoor playground when it's in the cold winters of Wisconsin. Not for the food. I'm not sure there's even any food to be found at McDonald's, but for the playland. And so then I sit there for like 2 or 3 hours, and that's where I kind of wrote part of my book and finished it. And I just had an idea, and I'm like, I've had this floating around for a while. What if I just started drafting this children's book? And before I know it, I've got one out there.
Yeah, isn't that amazing that McDonald's was able to build a clientele by selling to the kids?
Yeah, I'm not sure it's always been like that, if maybe but I know you can set like their food on the shelf and go back like months later and it looks the same. I don't think that's food. So I know this isn't about McDonald's, but it is about health. And yeah, so I'll still usually get fries or something, but sit there and watch the kids play.
Yeah. So, yeah. Well, and one thing that encourages me in the context of it, this is about health. We're seeing a lot of change in our country where we're starting to talk about what are we putting in our bodies, and things like seed oils and other things like that. And man, I don't know about you, and I'm not asking, but my wife tells me, she's like, Craig, you're weird. Actually, she actually says that a lot, but this particular type weirdness is I'm in my, late 50s and I'm on zero medication. And I just think, I mean, I go all the way back to when I was a young Marine. I realized, I don't need to be slurping down sodas at every meal. I had the metabolism to do it. I certainly got enough exercise, but I decided to start putting different things in my body. And here I am many years later, even after, spending 3 months in the hospital, nearly dying, going into kidney failure, I'm still on no medication.
Yeah, and the pharmacy industry would love to have you on a whole bunch of regular medications. It's great profit for them. And I'm the same way. I'm 51, and really, if sometimes they're there to help, but certainly would avoid it if I can. And a lot of that has to do with what we eat. They say you are what you eat. I think that holds true, right? My grandparents on a farm in Iowa lived to be in their mid 90s, and they ate food out of their garden. They grew garden in their backyard on the side, and I think there's a lot of sense to that. It's more of a long-term play, right? Not a short-term do it for 2 weeks or something, but it certainly is very relevant in our health today.
I was talking to my sister-in-law, and I'm not going to mention the drug or the manufacturer, but I said something, I just threw something out there, and it was about a popular weight loss drug.
Mhm.
And I didn't know that she was on that drug, but I strongly suspected. So I used my lack of absolute knowledge on that to throw something out, and I just said, "Oh, that's such and such drug. It's horrible. One third of the weight loss is from muscle mass, lean matter, and bone density."
Mm.
And she's a postmenopausal woman, and she's like, "Craig, I'm on that drug." And it's like the problem, and guess what? The problem isn't the drug's not fixing the problem. The problem is what are we taking in, and how much energy are we burning? How much are we doing that?
Yeah. Yeah, and there's certainly applications for extreme situations, but I think this culture of today, right, which is what pharmacy loves, is there's a pill for that if you're not feeling right or not, or if you're gaining weight, and all these different ailments that we face. Is the lack of a pill really a root cause, right? A headache isn't because of a lack of aspirin. And so there are applications, and I won't play I don't have a medical background, and I won't pretend to, but I don't think you need to have a medical background to realize too that these are a lot of new drugs, and they're having certain outcomes, but how are they getting those outcomes, and what are the long-term effects, right? We have no idea what the 5-year effects or 10-year effects of those GLPs are. And so I personally don't want to be a lab rat, and I would like to lose 5 or 10 pounds as well. But I'm going to try to do it naturally if I can, I guess. So.
Yeah. Well, and it kind of raises an interesting question that does tie back into healthcare. There was a period of time when your healthcare premiums were based on how healthy you were. If you took better care of yourself, at least that's my understanding, you tended to have lower premiums. If you smoked and were overweight, you tended to have higher premiums.
Yeah, and there's still some of that today in the smoking, but I mean, then you get the ACA. I believe it was the ACA wellness rules, right, that came out, and then of course you can't discriminate based on that, and we're just kind of this society of 11th place ribbons, and it doesn't matter what you do anymore. Everyone's supposed to be treated equal instead of a merit based society. It's everyone's the same, and I don't think that helps us. I don't even think that's what America was founded on. I think we should be fair, and every person has the same value. But yeah, we've gone a little bit too far in the other direction, in my opinion.
Yeah. So so anyway, when we talked last time, you were with Self Fund Health,
Hmm.
and now you're doing something new. Why the change?
Yeah, no, it's a great question, and I even smile when I get that question because I've always been highly entrepreneurial. I had a baseball card business when I was 10 years old, and I grabbed my snow shovel when it snowed, and I'd knock on doors, and my best friend and I would come home with a wad of cash like you wouldn't believe, and then we go spend it all on baseball cards. Spend it wisely. So, but I've always had that spirit, and I even had a construction business. I started at 19 and ran for 7 years, but then I went to grad school, and I followed this path that actually was very preparatory for me in what I'm doing today of leading transformational change in organizations, learning problem solving and lean at Toyota Motor Manufacturing at their flagship in Kentucky, and but following more of a career track instead of an entrepreneurial track. And I did that, and my passion was Great Place to Work. I worked at Badger Mining. We were the number one great place to work in the nation from SHRM and Forbes, and I had an opportunity to just learn from that and be a part of that. But really, I think at heart, I'm an entrepreneur. And so I had this success story at Merrill Steel in transforming the health plan, and then met John Barron, who is still a friend of mine. And I'm a part owner in Self Fund Health. And we grew it up. And for 2.5 years, we got through the hard stuff. And it's a rapidly growing health plan in Wisconsin, and now spreading across the borders a little bit. So, why in the world, Matt, would you walk away from a successful, fast growing startup? That's that's probably a good question, but it's really just goes back to my entrepreneurial spirit. But really, this entrepreneurial spirit is to help people, and can be a risk taker, but it's not to maybe to get a pile of money. Now that money's fine, and money makes life easier, I suppose. Too much money can cause a lot of problems. Look at all the lottery winners; their lives are all fall apart. But so money isn't my primary motivator. It's a great secondary or tertiary benefit, maybe. But my primary motivator is to help people. And I saw this. I wasn't looking in any way. In fact, I was kind of talked into it. I made a phone call that was really about a different topic and considered it for about 4 months back and forth, and ended up just, seeing more opportunity in Texas and say this can be a new lily pad to jump to and a new adventure. And my real goal is to help Americans get high quality, affordable, accessible healthcare to fix this pandemic of a problem, this plague of a problem that's affecting almost every American. And if we don't do something about this, the time is now. So I took a chance and went from a known to an unknown, but that's just kind of how I'm wired.
Yeah. What did you see in Texas? You said you saw some opportunity in Texas. What's it about? Because I live in Texas and kind of curious what makes us unique.
Right. Yeah. In fact, we're launching this health plan, the Rise Up Health Plan. It's called Rise Up Health. And we're actually launching in Austin and Amarillo first, which is here in Austin. And I think we'll spread to the rest of the state fairly quickly and maybe then beyond the borders. But there were really two things that excited me about this opportunity as we began to talk about it. First and foremost, so I'm Midwest farm boy, grew up on a farm in Iowa, and I've lived in the South a little bit in terms of Tennessee and Kentucky, but I've always admired Texas, and they joke about, right, the nation of Texas. That's not just a joke. That Texas actually was a nation for something like 9 years way back, and cultures are very sticky. And so this Lone Star culture, this independent thinking, right, American spirit culture of Texas is second to none in the nation of what we're really even doing here, right? We're saying the status quo, which the big healthcare industrial complex is actually protecting with with a ridiculous number of lobbyists in Washington, and right, they say as many as 7 per every representative the insurance industry sends
Wow.
there. I mean, that's crazy. And so we're up against this giant beast, if you will, but they're protecting this game because they're winning, but they're crashing American communities. And I don't know about you, I'm not okay with that. And I'm just one person. I can't fix everything, but I'm sure going to try. I've changed my career path from an almost 25-year HR career to being a fixer or supporter of fixing employer health plans across the nation. Texas has over 30 million people, right? Wisconsin has around 6 million people. We had to build it from scratch in Texas, by the way. When you start looking around, there are all sorts of independent medical practices in Texas, surgery centers and DPCs and you name it. And so that was the first big reason. The other is that this is associated indirectly with Sedera HealthShare.
Oh
We are
yeah.
not, we are not Sedera, but associated almost directly. And so this is a separate company. But there's those two big walls to a health plan succeeding, or an independent doctor or medical practice succeeding. One big wall is the networks. The networks are promoted as somehow we have buying power and we're getting you a better deal. Well, when you start comparing the prices, cash price versus best commercial rate or best negotiated insurance rate, cash wins most of the time. So that's a myth. That's a lie. But also, then you have to shop in network, right? Imagine if you only had to shop at Best Buy. I think they'd have to rename the store. It would no longer be Best Buy because they'd have you. They'd have you
Yeah.
if you can't walk away and they say, well, you don't like the price. I'm sorry. We'll see you tomorrow because you'll be back. And that's what hospital networks do. So we need alternatives and we need to open up this free market. And the second is that the BUCAs really have great influence over most of the sales force and the brokers in this country. And
Can you
so
define bucas for those that don't aren't up on the
oh,
lingo?
BUCAs, yeah, BUCA. It used to have an HN on there, a Humana, but they went more on the government side. So Blue Cross Blue Shield, United Healthcare, Cigna, Aetna is what we generically refer to as the BUCAs, or big insurance. And they have influence over the hospitals. They control them through patient flow. If the hospitals don't code or do exactly as they want, they don't get paid. And they also don't get patient flow through these wonderful networks. And secondarily, they control the sales force, almost 100% of it. And so anybody, by the way, if you're out there, if you're an advisor or you're a broker, brokers sell insurance, advisors look for solutions for employers. If you're either one of those and you want to talk about real solutions for employers, look me up.
Yeah.
That's what we're really after. We're not against anyone, but we are against oppression and bankruptcy and crashing American communities. And so
What
those were really, really the two things. And the reason the Sedera connection is that there are opportunities there to have a health plan not RBP. That's not this pay them half of what they build and hope they accept it. That's a strategy that some use and it works somewhere, but to have a strategy that's actually network free, which would allow us to spread without restriction. So a lot of complexity there, and glad to explain that. But if we can break through these walls, then we can really go out and help people.
I have a condition that pops up every now and then. It's called a schlasion. It's basically a big bump on the eyelid. And the procedure is real simple. They peel your eyelid back and they lance it on the backside and drain it. Well, and often they just kind of resolve on their own. But a few years ago, I had one that wasn't resolving. And so I started calling. I'm on a high deductible plan. And so I was going to be paying out of pocket regardless. And so I called one place and I asked how much. They said 350 and you're going to have to come in for an evaluation. I'm like, why do I need an evaluation? I'm going to walk in, you're going to look at my eye and say, holy cow, that's a chalazion. Let's lance it.
Right.
And they're like, and I don't think they would budge on that. So I called someone else, one of the biggest eye care providers in Austin, in Central Texas, actually. And it got even more complicated. And there was like, I think another visit involved. And I was like, how much is this going to be? They would never give me an exact answer, but my impression was that was around $800. And so then I called a third one, and it's in Lakeway, which is, very nice part of town. If you know Near Patel, that's where Near and his wife Katrini live. And or at least they used to. I don't know, maybe they moved more out to Spicewood, but her office is in Lakeway. And there's a big hospital there. And it was right next to the hospital. And they wanted me to do an evaluation, and I was like, can we just combine it into one? They finally said, sure. How much? And they said $250. I go in there, and for $250, I get a half hour with a nurse, 45 minutes with the surgeon, and a follow-up visit with the surgeon. And it was great. There was no rusty scalpels. It was great healthcare.
Right. Yeah, imagine that. I mean, I think, the coding process and the way hospitals get paid, and I would like to think that they're innocent and they're just affected by these big insurance, but all the hospital executives I talk to tell me don't think like that. They're not. They know what they're doing. But yeah, if they don't see you in person, they aren't able to code and they aren't able to get paid. And so yeah, does something like that really require two visits or multiple visits? And it's not likely. So when doctors go independent, which many are very frustrated within these systems, by the way, they can do things that make sense. They can still do great medical care. They're not taking shortcuts, as you joked, on medical care. They're just cutting out the big insurance, which is almost intentionally wasteful. And by the way, when I talk about doctors being frustrated, one of my many activities, if you will, is we've started this website called Lifeboat for the White Coat. Catchy name, probably won't forget it.
I saw that. Yeah, I saw you post that on LinkedIn. I love that.
Yeah, so that's an escape. A lot of times they go through, right, the medical school and residency and all the things, and then they're like, oh, there's like one path for this. There's only one path, and I'm in, right? I can't veer off. But there is another path, and it's this trend back toward independent medical care. And there's essentially two buttons on that website. One is to look for a job, so independent practices can post a job. And then the other is start a practice, which when some hear that, they get excited. Some hear it and get nervous. They'd rather join an independent practice. And then we're partnering with Freedom HealthWorks in terms of holding their hand to start a practice, and their success rate is pretty high. So it's somewhere around 93 or 95%. So the chances are pretty good if they help.
Yeah. Well, when I told Neer Patel that story about, the
Mhm.
Schlazion and what have you, and he said, Craig, I know exactly the clinic you're talking about. No, exactly, because we're practically neighbors. And he said, that one's independent. That's why you got that deal.
Right. Right. Yeah, it's really sometimes we make it difficult, and part of the trick is people don't realize, why isn't this movement, why isn't this taking off faster? Why it's so obvious, it's so intuitive to someone who can understand simple buying and selling, free market economics or business. A lot of it has to do with this buca grasp hold, right? If bucas have a majority of the plans in America, guess what? In this network I talked about, these independents, they don't let them, in many cases, they don't let them become in network. Or if they do, then they have this stranglehold on them just the same, and they're coding, and they have to hire a whole bunch of people to fire insurance or send in insurance claims off to the insurance, so they'll pay them. And so, but in many cases, if they choose to just stay independent and not be controlled by these networks, then they're out of network on all these employer plans. So if employees or members want to go to them, it's not covered. In many cases, it's better just to go outside the plan, right? 250 start to finish versus what would have been part of the deductible and all these other things, several visits. So yeah, as we start to just kick them out, we start to kick the bad guys out of the game. Lots of good things happen for employers and patients, and for independent medical practices, and hopefully eventually hospitals if they'll come along with us.
Yeah, and another example of that right here in Austin is a couple of years ago, I had to get I think a CT scan or something. It was some type of radiology. And my doctor, my former doctor, I'll say, because I changed that, that was a problem. They were wed to the hospital that nearly killed me. And and my doctor put out the order to the number one imaging provider in Central Texas. And it took like 2 or 3 weeks to schedule it. And I thought, I wonder if that's cheaper. And so I started looking. I just went on Google, and it turns out from one of the main hospitals, one of the leading hospitals in Austin, directly across the street is an imaging center. And instead of waiting 2 weeks, they said, Craig, we can get you in tomorrow. Instead of it being $800, high deductible, so I'm writing that check. Instead of being $800, it was $400. And it was a delightful experience.
Yeah, I think, I've got a manufacturing background, and some people, it's almost too good to be true, right? They're like a quarter of the price. They can get you in tomorrow instead of 3 weeks or 6 months or whatever they are, and the quality's better. And so some people have a hard time believing that. How could it be so much less and so much better, yet and be legit? And so one example I give, manufacturing. So I learned lean manufacturing. In fact, before I went to Toyota, I was at a supplier of Toyota. We sent all the original exhaust. We were about 3 hours away, and all the original exhaust for 3,000 Camrys and Avalons every 24 hours. That's a lot of exhaust pieces. And Toyota sent two consultants over free to help us. And we thought we had, I had just joined and I'm learning, but the folks that had been there a long time say, we've got a pretty efficient operation. And they came in and they helped. They just started saying why as a root cause, right? Why'd you miss your production today? Why'd you have this quality issue? They were actually annoying our people greatly. That's about, right? It's like, get out of our, please leave. Like, right? We know you're our customer, so we can't tell you that, but you could see it in their faces. But after 6 months, they started to get it, maybe even a little bit sooner. And they started to realize, wow, these guys are good. That whole that plant, we ended up functioning through attrition, but like with 100 people less, about 400 people, we picked up Honda. The efficiency skyrocketed, the safety skyrocketed, the delivery on time achievements skyrocketed. And so we see these, right, inefficient operations with a ton of waste, as Toyota would call it, processes that don't add value, that nobody's willing to pay for, but move it here, move it here, move it here, move it here, move it one time, things like that. So these hospitals are just full of waste, and in many cases required by insurance. That's why your doctor looks at their screen when they should be looking at you. They're trying to just get everything coded, or they'll get in trouble, or they won't get paid. So
Yeah.
that's how we do it. Think of it from an efficiency standpoint. You run in, and this place is operating like a top. Toyota's in their Georgetown plant is producing 3,000 cars every 24 hours, as I mentioned. No piece of inventory in that plant is more than 8 hours old, which is ridiculous. In many cases,
Mm.
4 hours old. They call that just in time. So you're not moving stuff around 5 times. But it's that efficiency is what creates quality, and that efficiency is what creates lower cost. And so what we're really talking about with these big hospital systems are really just a rat's nest of waste. And
Yeah.
we're all paying for it.
So, as you're launching in Texas, on our southern border, there's a practice that's pretty common. People that live on the border go across the border and get their health care over there. So, how's that going to work out for you guys?
Yeah, so far we've stayed domestic. just because even medical tourism, as we call it, traveling more than an hour, we'll even give them money to go to Oklahoma Heart or oncology centers or something. I haven't ventured, at least within the health plan, outside of the country. Now, a friend of mine, Tim Murray, who runs Surgery Center of Oklahoma like model in Milwaukee. My son still needs his wisdom teeth pulled. And so I texted him. I'm like, hey, Tim, can you help me here? I don't have dental insurance. And so he said, yeah, Cancun.
Wow.
You and your son could fly to Cancun for about less or the same price. If he flew alone, it'd be less than what you would just pay for wisdom teeth, which is crazy. And so I haven't ventured out of the country, but I know there actually, if somebody were comfortable, even in India and other places, there's some pretty high quality medical centers. But for now, just for patient comfort and education, we stay within the U.S. and generally within a few states and range. We don't go too far.
Now, you mentioned Oklahoma, and I don't think most people know what you're talking about. What's going on in Oklahoma?
Yeah, they're really the model, the original pioneer. So they're in Oklahoma City, founded by Dr. Keith Smith and Dr. Steve Lantier, co-founders of the FMMA, Free Market Medical Association, which was just last week. Their 11th conference, their 11th year as an organization. And they did something crazy. Now, they went through a lot of bumps. They had the Bucas trying to put them out of business and all sorts of things. But two anesthesiologists started their own surgery center, which is also what Tim Murray is, an anesthesiologist, same one in Indiana and others. But they were the first to do this. And they said, you know what, we're going to cut out all this waste. We're going to have an efficient, very well-run surgery center. We're going to hire the best surgeons, have the lowest infection rates around and so forth, far lower. And we're going to put eventually, I think it was around 2010, maybe in their 10th year, give or take. I'd have to look back at the dates, but 11, they put their prices online, and which was never is unheard of. And so one is in healthcare, it's mushy, right? So how much does this cost? How much? Well, this is this code and this code and this code. And it's like, no, how much does this cost? Well, they bundle it together and they say, if it's an easy surgery, it's the same. And if it's a hard surgery, it's the same. They've balanced it. So a hip replacement, and you can look on there right now, Surgery Center of Oklahoma, I think it's 19,400, give or take. Look for yourself, but that's the price.
And a normal price for hip surgery is what, like 40K?
Oh my goodness, it depends on the state. Texas, I'm learning Texas, probably 40 to 60K. I've heard as much as Wisconsin is far worse. The fourth worst in the nation, Wisconsin, I've heard as high as 150K for a knee or hip replacement.
Wow.
So, and I'd say the average in Wisconsin is probably 60 or 80. But yeah, so can you afford to fly the person and a companion, even if you have to, or drive a few hours and pay those travel costs? So the plan wins, right? So the plan wins, and the member not only gets it free in this case, but gets an incentive of, say, $2,500. And so we look at those two things. Insurance has taught us they want premiums to go up. So they've taught us to look at the card only and say, oh, 3,000 and I'm done, or 5,000 and I'm done. I don't care what the total cost is. We never shop for anything else like that. The problem is, even if you look at your card and you shop wisely, this year's claim cost or next year's premium increase. So then I think I got a good deal and I think I have good insurance. Well, next year and every year I go in and get a 27% increase or something ridiculous on my premiums. I'm not winning. And so that's how we win. That's how Merrill Steele's on their 8th year in a row of frozen premiums, with a family premium of $160 a month, single premium around $40 a month. And that's what it was when I started there back in 2016. But that's how you control it. You incentivize the members to get better care, and then you control the plan cost.
And you talked about efficiency. Here's another example from my journey. September 11th, 2021, I was in surgery. They were putting a trach in my throat. And of course, if you're in surgery, you have anesthesiologist. Well, just the weird thing, I was at a hospital that was in network, but my anesthesiologist was out of network, and got nothing for a long time. And then we start getting this bill, and it's almost immediately turned over to collections. I have a law firm calling me,
Right.
and I go through things and I realize they'd never billed me. They hadn't billed me within the first 11 months. which, for those that don't know, we have this, was it the speedy billing? What's it called? Basically, it's a legal requirement that you have to bill somebody by the first day of the 11th month after the procedure's given, or you can never collect money from them. And so that was kind of my out. Well, here's the problem. I lived, right? The anesthesiologist did his job. I kind of feel like they should get paid. But they had some crazy out of network price and all of that, and they just waited too long. They never filed it with my insurance, and that's just some of the inefficiencies. So if those anesthesiologists did the work but never got paid for it, well, they're still getting the country club membership. They're still getting the BMW. So that means they're raising the prices for everybody else.
Mm-hmm. Yeah, I mean, the theme this year for the Free Market Medical Association conference was Monopoly, like the game Monopoly. And I always like to joke, how does the game of Monopoly end, right? When one person has full control and everyone else loses. And that's what we're seeing. And if we had a true free market and you had nonsense happening, we could probably have 10 or more examples of, right, this anesthesiast, I didn't know that person was out of network, right, da da da. If there was a true free market, you'd say that was a horrible experience. I'm not going back. Like we would a restaurant or a car dealership or anything else we buy, a grocery store. But in healthcare, we say, wow, I had a horrible experience and I'm not even healed yet. And I'm getting calls from collections. I think I'll go back there next time I'm ill. Like that's insane, right? I was run over by a tractor. I shouldn't be sitting here right now talking. That tractor rolled into the mighty Wisconsin River after it rolled over me and broke five. I should have been maimed, but 5 ribs and a whole list of other injuries. I never had any treatment. I spent one night in the hospital because I wasn't able to walk out yet. I tried, but over 18,000 in bills. I never had any procedures. I just had a few CTs. They lit me up, right? But if I have another ER issue, guess where I have to go? And so that's not a free market. That's a monopoly control, and
Yeah.
that's the only way they have a line at their door, and it's the only way they get any business. So when we open up the free market, they either change like a bad restaurant, or they won't be around.
Well, one of my sayings is customer needs will be met, hopefully by you. And, it may not happen immediately, but over time, the customer wins because there's some entrepreneur out there just like you that says, I see something that's broken. Nobody's excited about the experience. And so you're popping up and doing that. And so before we wrap up, I want two things. I want to make sure people know about your new health plan, how to reach you. So where do they find out about this health plan and when is it launching?
Yeah. So we're looking to launch as soon as June or July, and you can reach out to me. I'm connected with many on LinkedIn. That's probably the easiest place to find me. You can just search my name on Amazon as well for these books we talked about, or Matt at riseuphealthplan.com. And so we've got a website started, and I'm really excited about some of the design we have and some of the ways that we're going to have to simply connect the buyers of healthcare, which is employers and employees and their families, and the sellers, which are independent practices, in some cases hospitals. But whoever gives us the best value is where we're going to try to shop. So that's
So
coming
you
soon.
just said something. I was assuming you were doing employers only. You're going to be doing employees as well.
Well, employers pay about
Uh, uh,
80% of the health plans, and then employees, yeah. So, and we have an interesting connection with Sedera too. So we're not directly working with them yet on that health plan. So I want to make that clear. This is a captive based with stop loss on the top, employer self-funded plan. But 50 and under, Sedera offers a great health plan, a great health share, about half, in my experience, half or less of what you'd pay on a fully insured plan. Or if it's 50 or above, then we're going to take them to the self-funded plan that we're creating, the Rise Up Health Plan, which is going to offer sustainable premiums and offer incredible care.
okay. And could a individual buy that instead of going through the marketplace, or is this just for employers?
So the Rise Up Health Plan is just for employers, but the Sedera, anybody can go on today and buy a health share. So if you're buying a big insurance plan, you're probably overpaying. I talked to a farmer couple a while back, and they were paying $1,000 a month premium, and their deductible, I forget, was 10 or 12,000. So I said, you're paying like 20 to 25,000 before you even get healthcare. Why don't you just put it in a savings and roll the dice? But the health shares offer more affordability in terms of a
Mhm.
non-legal, it's not legally insurance. It acts like it, but a non-insurance model, you still get great care, but you actually have some money left in your bank account. So Sedera can help with smaller employer group plans or individuals or families as well.
Very cool. And one thing I want to make sure we cover, because we kind of glossed over this,
Yeah.
part of your desire. So back to your children's book, Welcome to
Mhm.
Home. You're a you're a foster
Yeah.
parent, and so what was the motivation for writing that book?
Yeah, really, I think my heart is to help people. So it's welcome to our home. And then it's looking to be maybe a series. We'll see. It was kind of expensive to make, which I'll never get my money back probably. It's about $2,500 to make, and I get about $3 a copy margin. But that was never my motivation. My motivation is to help people. And we can do that in different ways. My wife and I are doing that through fostering. We've been doing this 8 years now. We've adopted. We've got another one that's maybe close. Even have a little 3-month baby in the house. We've carried 5 babies out of the hospital, which is an interesting experience that weren't our babies, plus our own, way back. And then the same with healthcare. My goal is to help people. And in healthcare, people are oppressed and they can't do it. Same with fostering. These foster children are thrust into the foster care system, and it's a bumpy ride. It's not a perfect system either. But we trying to help them, trying to love on them, and we love kids, right? Kids are innocent, and we want to give them a chance in life. And so we've had probably 30 or approximately kids come through our home for that.
Wow, that's amazing. Well, Matt, thanks for coming on Leaders and Legacies. I do hope people reach out to you, and I'm interested in seeing what you launch here in Texas, especially for me, and places that could apply to me. And thank you. Thanks for all that you're doing.
Yeah, likewise, Craig. I'll be right there in Austin in many cases with you. So we'll have to get a bite to eat or something or a coffee. But thank you for all you're doing as well.
Absolutely.